The Asia-Europe Foundation, ASEF, is an intergovernmental, not-for-profit organization which brings together the people of Asia and Europe to address common global challenges. ASEF works on a diverse range of topics in 7 thematic areas. We contribute to sustainable development by engaging civil society, policymakers, and businesses to foster interregional cooperation between Asia and Europe on sustainable development and climate change. The Asia-Europe Environment Forum, ENVforum, is a long-standing program aimed at achieving a more sustainable world. Since 2013, ENVforum has been actively engaged in the global discussion on the Sustainable Development Goals, or SDGs. We launched a program to contribute to the bottom-up process that supports the implementation and monitoring of SDGs. This is based on 3 pillars. 1. Undertaking research on SDGs and their associated indicators. 2. Organizing knowledge hub meetings of experts working on SDGs and indicators, as well as on the green economy. And 3. Disseminating the outcomes of consultations to policymakers. The ENVforum is a consortium of 5 organizations. In 2020, the ENVforum will host our first virtual conference titled Connecting the Dots, Creating an Enabling Environment for SDG 12 in ASEP. Under the umbrella of circular economy, the conference will look at 4 themes and incorporate challenges related to addressing the COVID-19 pandemic. Visit our website for more information and for registration.
Hello everyone. Thank you very much for joining our webinar, SDGs and AMR, a silent pandemic. This is an introductory part of the sessions for the ENVforum 2020 from 9th to 11th November. If you haven't registered yet, please do so. My colleague will put the registration link on the YouTube live chat. At any given time, you may submit your questions using YouTube live chat. Please indicate your name and where you are from. We will have a Q&A session after the third speaker has finished talking. The COVID-19 pandemic demonstrated an impact of the health crisis on our society, including the ability to achieve SDGs. It is also proven that the health sector alone cannot combat the health issue. Support from the society is essential to combat COVID-19, such as social distancing and hand washing. The same can be applied for antimicrobial resistance, AMR, which is often referred to as silent tsunami or climate change of health. Today, we name AMR as a silent pandemic, which is already happening. AMR is a slower moving pandemic than COVID-19, but we need to acknowledge it will be a public health and economic disaster without our contribution as a society. The ultimate aim of the webinar is to encourage intersectoral collaboration between health and non-health sector over the challenges that may appear to be a health issue alone. As such, collaboration is essential to achieve SDGs in a post-COVID-19 era. We use AMR as an example area for intersectoral collaboration concerning SDG 12. Responsible consumption and production. This webinar serves as an introductory session to understand basic issues surrounding AMR, which requires actions beyond the health sector. Now I am pleased to introduce you our 3 speakers here. They are joining from Australia, Japan, and Netherlands. For the interest of the time, I will let them introduce themselves at the start of their presentation, and I will give the floor to the first speaker. Jason will talk about basic information related to AMR. Jason.
Thanks, Riko. Hi, everyone. Apologies for having my camera switched off. I thought I would spare you the side of an eye infection I woke up with yesterday. So I'm a journalist and I've been reporting on various aspects of antimicrobial resistance in Asia for the past 15 years. I'm based in Australia, but I've spent almost 8 years in Singapore and have traveled and worked extensively across Asia, but in particular in China and in India. In the next 10 minutes, I'm going to look at AMR, what it is and why we should all care about it, and try to mitigate this threat. What's AMR? Well, it's an umbrella term used to describe a global calamity. That is, the drugs we've developed over the past 8 decades, the miracle cures that have saved millions of lives, are fast losing their ability to kill the germs that kill us, as well as the germs that are affecting our farm animals, our pets, our aquaculture, and our food crops. These drug-resistant infections occur when pathogens change in ways that render antimicrobial drugs ineffective. As a result, the pathogens survive and continue to spread. The phenomenon of drug resistance isn't new. In the earliest days of penicillin, scientists have understood that bacteria can develop mutations that enable them to evade destruction by antibiotics. For a few generations, we humans were able to stay ahead of germs in a kind of arms race. Problem is, investment in new antimicrobial research has diminished, and we have had a dearth of new drugs come onto the market. And the problem doesn't just affect our susceptibility to bacteria, it spans the full range of infectious agents and organisms, viruses, fungi, and parasites as well. Next slide, please. AMR has become a critical challenge of the 21st century, right up there with things like global warming and terrorism. In fact, the World Health Organization has declared AMR one of the top 10 global public health threats facing humanity. The problem is truly global. There is no country where antimicrobial resistance doesn't exist, but there are big differences in where the problem is being mitigated and where it's out of control. And because microbes don't respect international borders, these pathogens are transported around the world in people, animals, and products. The misuse and overuse of antimicrobials are the main drivers in the development of drug-resistant pathogens, but a lack of clean water and sanitation and inadequate infection prevention and control promotes their spread. The cost of AMR to the economy is significant. In addition to death and disability, prolonged illness results in longer hospital stays, the need for more expensive medicines, and financial challenges for those impacted. Without effective antimicrobials, the success of modern medicine in treating infections, including during major surgery and cancer chemotherapy, is severely undermined. Next slide, please. 4 years ago, it was estimated that worldwide, at least 700,000 people die annually from drug-resistant infections. That number is projected to balloon, reaching 10 million a year by 2050, and will cost more than $100 trillion in lost economic output without corrective actions. That's according to a UK government study led by economist Jim O'Neill. His review estimates that by the middle of this century, more people will die from superbug infections than from cancer and diabetes combined. This is like a succession of COVID-19 pandemics played out in slow motion over several decades. The World Bank forecast in 2017 that unaddressed AMR could inflict an economic impact in excess of $1 trillion annually after 2030, with low and middle income countries disproportionately affected. Next slide, please. So as I mentioned, when we talk about AMR, we're not just talking about antibiotic resistance, but resistance across all classes of infectious microbes. You might have already heard of MRSA or MRSA or golden staph. That's methicillin resistant Staphylococcus aureus. But that's just one of dozens of problematic bacteria. When we add multi-drug resistant tuberculosis and multi-drug resistant gonorrhea, it becomes a truly enormous global health burden. Then, of course, we have resistance to key treatments for malaria, flu, HIV, and fungi. Next slide, please. As I mentioned, the main driver of AMR is the misuse and overuse of antimicrobials. This occurs in the human health sector, in hospitals and doctors' rooms, with people self-medicating and buying these medicines over the counter. It also occurs on farms, in aquaculture and the production of food crops, and especially in the raising of livestock. Antibiotics are routinely used to make animals grow and gain weight faster, as well as to prevent diseases, not just to treat them. What's especially troubling about AMR is that there is a large crossover of drug-resistant pathogens from humans to humans, and from humans to animals, and animals to animals, and animals to humans. Wastewater can be a conduit for these germs, since it contains not only drug residues, but drug-resistant microbes, as well as the genetic material that can contain recipes for enzymes that destroy antimicrobial medicines. Especially in places without good sanitation and hygiene, wastewater can contaminate drinking water and the food supply, spreading germs to people and animals. And when this transmission leads to an infection, often even more powerful medicines are needed to treat those infections. This constant cycling of drug-resistant pathogens really highlights why AMR can't be tackled effectively by any one sector. It needs the human health, animal health, the environment, and the water and sanitation sectors working together under a One Health approach. So what can we do about this? Well, each and every one of us can play a role in mitigating the AMR threat. We can stop misusing antimicrobials by not taking antibiotics, for example, when we have a viral infection. We can ensure we practice good hygiene and food safety. We can get immunized against vaccine-preventable diseases. We can elevate the topic of AMR and create awareness of the problem like we're doing right now. And we can lobby our politicians and decision makers and persuade them to fund the development of new diagnostics, new drugs, new vaccines, and other tools that will help reduce our reliance on antimicrobials. And we can use our power as consumers to buy food that is produced without the routine use of antibiotics for growth promotion and disease prevention. So there's a lot we can do individually and collectively. Riko warned me not to get too medical. To me, the ways in which AMR is forcing changes in medical and surgical care and their outcomes right now, making this a very real threat and not a hypothetical one, are why we all need to be paying attention to this now and doing something about it. I may have finished a little early, which hopefully means that we'll have some more time for questions. Thanks for your attention.
Thank you very much, Jason, for giving very good overview of AMR, why it's an issue, how we have role to play as individuals. So next, I'm pleased to invite Kinzang, who will be giving us more insight about animals and antibiotics.
Yeah, sorry, the microphone was not muted. So anyway, thank you, Riko, for the invitation. And at the outset, I would like to thank the organizer of this webinar for inviting the OIE to participate and present on this very important topic, a very topical topic. And so today I will be presenting very briefly on the issue of AMR from the animal health perspective and food chain in Asia. So this will be the profile of a presentation. This is just to show you the show you from where we are. So basically, I'm working with the World Organization for Animal Health, OIE. So I'm currently working as the regional project coordinator based in Tokyo, and our head office is based in Paris. So we are an organization responsible for animal health and animal welfare. And we have 32 members in this region. So just to give you a very brief background about the issue of AMR in the animal health sector is that, first of all, I think this slide shows you the rise in the demand for protein, especially from the animal protein, because of the increasing population of humans and also because of the increasing purchasing power over the years, over the decades. So because of the huge demand on animal protein, you can see here that the graph on the left-hand side shows you the distribution of the growth in the poultry meat demand from 2000 to 2030 in Asia. So overall, we can see that there has been a huge demand for poultry in South Asia by almost like more than 700% by 2030. And also experts have actually predicted that the demand for pork is also going to increase by more than 50% in China by 2030. So this huge demand for animal protein has actually resulted in change in the production landscape for livestock production. So as you can appreciate that livestock is one of the fastest growing agricultural sectors, and this huge demand for animal protein has basically changed the landscape from backyard free-ranging farming, wherein our farmers used to rear few number of animals or birds, to a more intensive or commercialized, system farming, whereby tens of hundreds or thousands of poultry and animals are being reared in a confined environment. So this has actually resulted into the need for more like enhanced hygiene, sanitation, and biosecurity measures in these kind of farms. And also because these animals and birds are kept in close environment, so they are also more vulnerable to diseases and also rapid spread. And because the farmers and the producers, they actually invest a lot of money in setting up this kind of farms, so it also results in economic vulnerability. So all these factors have actually resulted in the farmers or the producers, making use of a lot of measures, including the use of antimicrobials for the prevention and control of animal diseases. So this graph on the left shows you the consumption of antimicrobials that's predicted to occur by 2030. The purple color indicates the intensity of the consumption that's going to occur in chicken. So overall in Asia by 2030, we are going to see a nearly 50% increase in antimicrobial consumption as per experts. And for the region, China and India are the major consumers of antimicrobials in food animals. So this fact has also been corroborated by the recent OIE global report on antimicrobial usage that was released earlier this year. So this report clearly shows that the Asia Pacific region is one of the highest consumer of antimicrobials for livestock production as compared with the other regions. And also you can see here that at the global level, currently we are consuming about 144 milligrams per kilogram of animal protein produced. So, and this data is based on the data that has been submitted by the OIE members. This slide shows you based on the OIE global report, it shows you the use of antimicrobial growth promoters, we call as AGPs. Still, we can see that 35 countries around the world are still using AGPs for livestock production. And in Asia, there are still 9 countries that they still use the AGPs. However, for the OIE, as a global organization for animal health and welfare, we always encourage countries to phase out the use of antibiotics for growth promotion in the absence of risk analysis. So this means that we are still having a lot of issues related to AMR in the Asia Pacific region. For instance, we have seen that in many countries, the legislations are either weak or they are enforced in a weak manner, so that there is not very good regulation of import, production, sale, and monitoring of antimicrobials being used. And also there is a weak supervision on the usage of antimicrobials in animals. And also, as I said earlier, a lot of countries, they still use the AGPs without risk assessment. And then overall, like even the AMR surveillance in the animal health sector is quite weak in many countries. So, and most importantly, there is still lack of awareness amongst the producers, farmers on AMR. So all these have actually led into the over-the-counter sale, misuse, and inappropriate use of antimicrobials. And also, we don't have quality data to support policy action. So all these factors actually, they lead to the contribution to the development of AMR. So this slide just to show you some of the good experiences that you might perhaps learn from Europe. So the EU, as you can see, they have been sort of championing the cause of AMR. So they have actually instituted a lot of good practices, like they have a very strong legal framework in the usage of antimicrobials in livestock production. And they have actually banned the use of AGPs since 2006 in livestock production. And they also have a very good monitoring system, an online monitoring system for the usage of antimicrobials in livestock production. And also they have a very good surveillance system in place. So as you can see on this graph on the right, this graph actually shows you the trend in the usage of antimicrobials in the EU countries over the last 8 years. And continuing with the experience from Europe, I'd just like to share you maybe the UK experience, which actually also shows a very good example wherein the UK government has been able to bring down the consumption of antimicrobials for livestock production over the years. So you can see here that over the last 5-6 years, they have been really able to bring down the consumption of antimicrobials in different species. And also they have a very good system of antimicrobials are being sold or supplied only on prescription by a veterinarian, which actually is not there in most of the countries in the Asia Pacific region. And also the sale of medicated feeds are also done only on prescription. So with this information as a background on the importance of AMR and how important is it to regulate the use of antimicrobials in animal production. So what can you do as a stakeholder to tackle AMR? So as Jason already clearly mentioned about the multi-sectoral need to work together. So if you are a government regulator, actually we want your support in developing and implementing good legislation for the responsible use of antimicrobials. And if you are a private sector, or if you are a manufacturer of drug manufacturer, importer, or retailer, we actually like you to comply with the good manufacturing practices and also comply with the regulations. If you are a farmer, a producer, we request you to apply good animal husbandry practices so that you don't need to resort to use of antimicrobials unnecessarily, and only use when prescribed by the veterinarians. If you are a consumer, if you are a general population, I think you also have a role to play. So you should be aware of what AMR is, as we are doing today, and then you should try to lobby using your influence with your politicians, with your policymakers to bring about change in regulations and addressing AMR. And most importantly, I think we should spread the word about AMR amongst the consumers and the public. So for the OIE, we are also working very hard. We have several activities to address AMR at the global, at the regional, and at the local level, at the country level. So we do that basically using our global strategy that was released in 2016. So for more information about OIE activities, you can visit our website to see the activities. So this is my last slide. So basically today, when you leave this webinar and go home, I would like you all to take at least some few messages with you. Firstly, AMR is an emerging threat, as has been already highlighted. It is a silent pandemic, sort of a ticking time bomb. So it's not been realized by many. So I think we really need to maintain political engagement at all levels, and we need to really work together as a multi-sectoral approach to address the issue of AMR. And it really occurs because of the inappropriate or misuse of antimicrobials in the human sector, in animal health sector, and also in the environment, as highlighted by Jason earlier. And we really need to spread the word of AMR because many people and many stakeholders, they still don't understand the importance of AMR. So we really need to work on that. And just to share this information that the week starting from 18 November, for 1 week, the tripartite, the FAO, the OIE, and the WHO, we are actually organizing several events during the World Antimicrobial Awareness Week. So we request you all to take a part, to please participate at different levels, wherever you're present, and share your story if you have any interesting story, and then try to participate and contribute to raising more awareness about AMR at various levels. So with that, I'd like to end my presentation, and I thank you so much for your attention.
Thank you very much for Kinzang to give us very clear overview of animal health sector and AMR. And yes, let's increase awareness of AMR among the general public as well. And to make them worry about AMR, maybe Danny can help because he can make linkage between AMR and COVID-19.
Thank you. And thank you, Riko, also for the invitation. Good afternoon, everybody. So my name is Danny de VRIES. I'm an associate professor of health at the University of Amsterdam and a senior researcher at the Amsterdam Institute for Global Health and Development. I also currently lead a project by a Dutch consortium on the social impacts of coronavirus, COVID-19, on physical distancing. And I work with the European Center for Disease Prevention and Control and other organizations. I also, and this is why this Sonar Global logo is on this slide, I'm a co-investigator with this project. It's an EU funded project for 3 years. Working on preparedness and response to epidemics, working on vaccine hesitancy, but also the prevention of antimicrobial resistance. And as part of this, I am co-leading the capacity strengthening work package. So my entry into AMR actually started with this project because we are developing curricula for social scientists and non-social scientists on antimicrobial resistance. Enough about me. So I think already Dr. Kinzang just noted the problem that we're having with the challenge of spreading awareness of AMR. It's not very well understood by the public, but also not amongst politicians and policy advisors, but also amongst scientists, including social scientists. So I posed this question to myself: Can we use COVID-19 as a way, as an analogy for the impact of AMR? And I think analogies are useful. An analogy is a comparison between one thing and another, typically for the purpose of explanation and clarification. And using this analogy, I wanted to cover these two questions. First of all, what actually is the direct connection between COVID-19 and AMR? And secondly, to what extent are these analogies of each other? Next slide, please. So first, I'll start with this direct connection. Next slide. So first, an antimicrobial, as you know, is an agent that kills a microorganism or stops their growth. For example, antibiotics are used against bacteria, and antifungals are used against fungi. Antivirals are used against viruses, such as, for example, protease inhibitors for HIV and hepatitis C. I'm not a medical scientist, but I'm trying to walk you a bit through this direct connection. Because one thing that we know is that generally COVID-19 is a viral infection, and antibiotics cannot be used to treat it generally. However, there is some experimentation with antibiotics as alternative therapies for COVID-19. For example, there's an antibiotic called teicoplanin, I'm not sure how you pronounce it, which has shown some potential complementary antiviral activity against SARS COVID, which was the predecessor of COVID-19. It also seems to have done something for Middle East respiratory syndrome. This is MERS, as well as Ebola virus. So far, this antibiotic is suggested as a adjunctive therapy for severe cases of COVID-19, which means that it is being used to see if it may be helping against COVID-19, which means that the use of it will be increased. Another more common relationship comes through the treatment of secondary infections that can occur as a result of COVID-19. It's not COVID-19 itself, but it's the thing is for example, bacterial pneumonia, which people then develop, and that's being treated with antibiotics. So what we've seen in some studies from Wuhan by Zhu et al. And Chen et al. Is that about 70 to 95% of all the patients have been treated with antibiotics. We also know that the SARS, during SARS in 2003, there was antibiotic resistant bacteria that started to develop, which we call superbugs, and they led to a much higher mortality of cases and complication during treatment. Another problem that's related is that we see that the compliance with AMR stewardship measures, which is in hospitals, there are lots of measures that make sure that we don't overuse antimicrobials. These stewardship measures are difficult to maintain during a crisis like COVID-19. A third aspect is the postponement of other treatments. We see, for example, interruptions of people taking treatments for tuberculosis, which can lead to multiple drug-resistant tuberculosis, which is a form of antimicrobial resistance. And that's because with antibiotics or antivirals, one has to take them regularly, and COVID-19 has been interrupting this. So there is a link between the two that's direct. Next slide, please. So, for example, Clara Balesta of the IS Global Antimicrobial Resistance Initiative wrote, quote, "Unfortunately, although it's still too early to gauge its full impact, the new SARS-CoV-2 virus, which is COVID-19, appears to be exacerbating the problem of antibiotic resistance." Next slide. And similar, the former Center for Disease and Prevention, the United States agency directors wrote, quote, "The challenge of antibiotic resistance could become an enormous force of additional sickness and death across our health system as the toll of coronavirus pneumonia stretches critical care units beyond their capacity." Next slide. So to what extent can we then say that there is an analogy between COVID-19 and AMR? We know there's direct relationships with that. COVID-19 seems to make the problem worse, but is it also a good analogy that we can learn from? Next slide. And I think already this was already looked at a little bit by Jason just now. You see here that if you look at the number of deaths, globally estimates from 2016 suggest that AMR leads to about 700,000 deaths per year. This was already mentioned through the O'Neill report that was done in 2016. And on the left, you see a map with the numbers of deaths annually by 2050 due to AMR. And so there you see that if you count these up, this was also already mentioned, we're looking at about 1 million deaths per year, which is a lot of deaths. And on the right of this, you see a map with the current death toll of COVID-19, which you see is also about 1 million. Of course, we know that the impact of COVID-19, we expect and hope that it will flatten over the long term once vaccines roll out. So by 2050, we do not expect 1 million deaths per year, although, of course, nobody can look into the future. But we can see in this way that the analogy works in the shorter form. But over the longer term, AMR most likely will cause more deaths than COVID-19. A difference you can also see in these maps, by the way, is the geographic spread. We see that the global impact on AMR appears to be mostly in Africa and Asia, while COVID-19's impact at this point is North, South America, India, and Europe. Of course, we know this may change. Next slide, please. And Jason also already mentioned the economic impact. If we look at the economic impact, we see that for the European Union alone, ECDC, the Center of Disease Prevention Control, has estimated a cost of at least 1.5 billion in extra healthcare costs and loss of productivity. In 2017, the World Bank estimated that the drug-resistant infections could cause an annual global economic damage that's similar to the 2008 financial crisis. And I think Jason mentioned that it's about $1 trillion per year, which is the economic impact reference. So the pre-COVID-19, the financial crisis, sorry. Of course, the impact of COVID-19 on the economy is hard to know, and we know it's very dramatic. We know that the complete shutdown of economies during COVID-19 is far beyond the annual economic impact of the 2008 crisis, and probably will exceed $1 trillion per year. In a table that you can probably not see very well, you can see that on average the loss is about 20% in different regions in the world and in the index of industrial production. So how does this compare? It's a bit unclear, perhaps. We do know, of course, that the costly impacts of AMR on the GDP will be felt annually for a much longer period of time, while we hope and expect that the impact of COVID-19 will be more temporary. So it looks like in the long term, AMR is not easily outshined by COVID-19. Next slide. Another way of looking at it, the analogy, is how it confronts what we think of our systems, and particularly the fragility of our systems. We may argue that COVID-19 has shown many people that what it is about when we do not have medicine to rescue us. It has exposed systemic public health fragility that we were not aware of previously. Of course, and regrettably, a lot of people in the world live in constant state of precarity, and they have been aware of it. But us in Europe and also in Asia, many of us may not have been so aware of this up to now. AMR similarly emphasizes a world where public health becomes fragile and when many of our antimicrobials do not work anymore. So the basic tools of modern science suddenly need to be rethought, and no feasible alternatives are in near sight. So I would say the analogy works here because in both cases, the vulnerability of the public health infrastructure is being exposed fundamentally. And for both, there are huge investments in international collaboration and collective action that are needed to overcome the challenge. Of course, the good news is that we now see that what we're capable of in responding to COVID, and we hope, of course, that if people become aware of AMR, we may become aware of the same, and we may be able to take action. Next slide. So another way of looking at it is the role of biomedicine. And perhaps the analogy may fall flat on its face here. In the case of COVID-19, there's a clear role laid out for biomedicine. Biomedicine and public health generally is to find out a way for us out of this struggle. So the symbolism of the biomedical technologies are that they're all about hope and way out of uncertainty. It is about sort of the heroism and enormous respect we have for health workers putting their safety, their own personal safety on the line to protect others. It's about the globally imposed waiting period that we have now for a vaccine or a possible medicine to rescue us. And this is where biomedicine will bring us hope. It gives us hope. For AMR, this actually may be the opposite, because the symbolism of biomedical technologies in AMR is about it being its own demise. Medicalization of our society has brought antibiotic technologies deep into our market economy. For example, Dr. Kinzang just talked about veterinary and meat production processes, and that has been accelerating AMR. And we know that the early inventor of antibiotics, Alexander Fleming, in 1928 already cautioned against antibiotic resistance. It's a given in a way that the bacteria will adapt to our medicine, and so we have to continue to develop medicines. But the overprescription of antibiotics or the misuse of antibiotics in health, in veterinary and agricultural sectors has caused higher than natural evolutions of resistance. And Fleming and his successors definitely have been given heroic status about what they've done, but this heroism is fading when it comes to AMR. And there's no clear role laid out for biomedicine here. Hope is not the key word used to describe its role. Rather, biomedicine's inability to stop the exploitation of its products makes it more of a bystander in its own demise. Next. So when we look finally at the framing of causality as another analogy, what caused COVID-19 and what caused AMR? And there's something important there I think I wanted to point out, is that it really depends on the framing of how we politically frame this causality. Because one framing would suggest that COVID-19 and AMR may be external and random sort of natural events over which we have little control and blame. And COVID-19 is natural, it's an unavoidable virus, and we know that historically pandemics will occur. We could just have to deal with it. And AMR, we know, is a natural process that microbes or bacteria are mutating and evolving, and they're outsmarting our technology. It's them, it's not us. And that's one framing of causality. Another framing suggests that both AMR and COVID-19 are the result of much more complex interactions between humans and our natural environment, or what we call natural environments. When you look at COVID-19, we know that more than 6 out of 10 infectious diseases and 3 out of 4 new or emerging infectious diseases are spread to humans from other animals. And the more we encroach our natural environments, the more interactions like such happen between what you call zoonotic disease outbreaks, just like COVID-19. And with AMR, we know it is caused by how we treat and cultivate our personal microbiome, like the foods we eat in our bodies. We know it's about the interaction between the environment and ourselves in terms of sanitation, in terms of pollution. For example, think about hog farms, and about the way we interact with animals and livestock. So the analogy here, I think, is that we need to work hard in both cases to be self-critical and to be reflexive. So if we want to learn from these events, then we need to interrogate our systems. And to do this, what we need is a global education on the causal complexity of COVID-19 and AMR, and this is very urgent. Next. So in conclusion, to finish, COVID-19 seems to be exacerbating the problem of AMR. COVID-19 is also an entry for us to think about the true scale of AMR. And as analogies, comparing them clarifies the magnitude of the AMR challenge. And we see that AMR rivals COVID-19 in terms of longer-term deaths and economic impact. We see that AMR and COVID-19 both confront us with the fragility of our public health systems. They differ, however, in the role which biomedicine may take, which is more questionable when it comes to AMR. And both AMR and COVID-19 are caused by the interaction between environment and society. So what we need urgently is more global education to help us reflect on the problem of AMR. And for example, the SONAR global curricula that we're developing right now, on which are called Special SOC and Upward SOC, are meant for trainers to conduct training and education for social scientists or non-social scientists or policy advisors or politicians on AMR. So hopefully we can make a little contribution there. Thank you very much.
Thank you very much for Danny making linkage between COVID-19 and AMR. Now we can move on to the Q&A session. We have a few questions posted on YouTube, but before going there, I have a question. Jason, as a journalist covering lots of health incidents, do you actually have some example on like no medicine to rescue us situation Danny explained?
I'm sorry, I'm not understanding your question, Riko. Can you rephrase that?
Like some example on no medicine to rescue us situation. Have you ever covered any situation or instance of medicine actually didn't work kind of situation?
Oh, okay, right. Yes. So we're seeing that occurring all the time now in many countries. as Danny mentioned, we have this microbiome of different kinds of microbes that live in us and on us, including friendly bacteria that help with vitamin synthesis and our immune systems and helpful things like that. But these bacteria like E. coli, they can harbor multi-drug resistant genes. And they can be very silent, and they don't necessarily do very much and don't necessarily harm us. But if we get a urinary tract infection, or if you're a man and you might need your prostate biopsied, these friendly bacteria with multi-drug resistance genes can become life-threatening. So in recent years, we've seen men dying from having their prostates biopsied because the antibiotic they were given to stop an infection hasn't worked, and they developed sepsis. And now, increasingly, we're seeing cancer patients who are dying from their chemotherapy because the chemotherapy leads to an infection that can't be cured with antibiotics, with any antibiotics. So that's becoming a major threat because we rely on chemotherapy to treat cancer. So there are a couple of examples, Riko.
Thank you very much for giving us example from real life. So now I will go into the question from the audience. I have two questions which is quite similar. Is there any example of regulation or good practice on antibiotics used for animals in Southeast Asian countries or South Asia countries? So I think this might be for you, Kinzang.
Okay, thanks so much for the questions. Yeah, actually, since 2015, once the global strategic plan for AMR was developed by the WHO and by the tripartite. So since then, I think in many countries we are seeing some actions being taken. So in many countries in Southeast Asia and South Asia, they do have regulations to regulate the use of antimicrobials in livestock production. However, as I said earlier, there are some challenges in the implementation, and it is not done as it is supposed to be done. So although they have regulations, the implementation is still a big challenge. And there are some countries where actually they do have very good regulation systems, like in Thailand, in Southeast Asia, of course, besides Japan, South Korea, and China. Of course, there are also countries like Bhutan, where the regulation is really good in South Asia, and also the implementation is really good. So for Southeast Asia, Thailand, Malaysia, I think the Philippines, they do have good regulation and also being implemented.
Thank you very much. Related to this, do you think consumer can put pressure in a way to the farmers? Because I know OIE is working very hard and everything, but it's also very difficult to stop farmers from using antibiotics because they ultimately worry about their profit, economic gain. So, but if they make animals for food with antibiotics, but if consumers don't want them, they cannot sell it. So there is not much point. So in that way, how much do you think it will be effective to have that kind of awareness among consumers than producers? Okay, it will be easier if it comes from producers, but it's probably difficult. So can you elaborate a little bit on consumer pressure kind of thing?
Yes, thank you so much. I think that is more of a sociology question, sociological perspective. But anyway, so for the OIE, like we have, as I said earlier, we do several activities to create awareness in the countries at all levels, to the regulators, to the private sector, producers, farmers, and also to the consumers. So as I think you're right that ultimately it is in the hands of the consumers, how they, whether they decide to consume a product which they feel safe or which they feel, more comfortable to eat. So definitely I would say that consumers has a huge role to play in bringing about this kind of good behavioral changes in the amongst the farmers or amongst the producers. So this is one area actually we have not been able to really achieve good results. So perhaps this is one area where other stakeholders like ASEF and also the other NGOs, INGOs can play an important role in creating more awareness and trying to garner support and use their influence to sort of give a sort of nudge to the consumers to take action. Yeah.
Thank you very much. Maybe ASEF can be one too. And since we have social scientists, can I ask Danny your quick opinion on this?
Thank you. Yes, it is, of course, the problem of public awareness, and if people don't want cheaper meat, for example, and then they cannot afford it, if it's not used with antimicrobials, if antibiotics are not used and prices rise, that's a problem. It's true that that is a huge challenge, and behavioral change programs are important there. There's also the associated problem of just general poverty reduction, where people, if they have better economic situations, would be more able to purchase higher priced products. One of the things that could be thought of are more economic incentives and regulations, and to make sure that there are certain subsidies that are on the right things, that on the right products that actually are not promoting AMR, and therefore that could reduce the cost. So that may be a policy intervention. But this is a dilemma. I hope I got the question correct. I'm not sure if I'm responding correctly.
Yes, I think you responded what I asked. And let me move on to other questions because I have few minutes left and a few questions. Okay, this can be controversial, but maybe Jason might be answer. Okay, how much is Big Pharma to be blamed for this with years of oversubscriptions for profit? Jason, have you ever covered this kind?
Look, I think that we could not lay blame for that on pharmaceutical companies alone. It's something that we would all have to share in the blame for. It's the prescribers, it's sometimes the patients who put pressure on the prescribers for a prescription, for example, for an antibiotic when they have influenza or some other viral infection. Then also consumers will sometimes, particularly in countries where over-the-counter antibiotic sales are available, they might seek treatment that way. So I think we all share the blame, and we all need to do something about it.
Thank you very much. And another question, this is also interesting. Health risks are high in third world countries. How can we protect ourselves from the silent pandemic in the wake of winter? Anyone want to take this?
I would say, Riko, that there are vaccines for bacterial causes of pneumonia, and we have vaccines for influenza. So there are certainly vaccines that can prevent disease, and where they're indicated, we should get them because that does reduce our reliance on these antimicrobials.
Thank you. So we can use other measures not highly depending on antibiotics. That can be one way to protect. protect. Another way is like we are doing, we can increase awareness, then we can be wise consumer, then that might change the game.
Another thing, Riko, we have seen that in the Southern Hemisphere during the winter, that with the public health measures that were designed to prevent the spread of COVID, we prevented the spread of other sources of respiratory diseases and deaths. So in New Zealand, for example, all-cause mortality in New Zealand is on track to decline 5% in 2020. That means that 1,500 New Zealanders who would otherwise have died in 2020 will be alive at the end of this year. And that's all because of the public health interventions, the social distancing, the not going to work when you've got a cough or cold, washing your hands, wearing face masks. These sort of things do prevent people from getting these respiratory infections. And that means we're also using antibiotics and other antimicrobials less.
Riko, you're muted. Yes.
Oh, sorry. Thank you very much. That was very hopeful news among all the situations we covered today. So maybe I can do one more question. The alternative cycle. Okay, there is need for livestock producers, both large and artisanal, to understand the implications of antibiotics. How can this be done effectively? Maybe Kinzang, who deal with farmers more than others. So
Yeah.
different size.
Yeah, so I mean, as I said earlier, I think it's not a very easy job to convince farmers, to adopt practices to change the behavior of farming, so that they can reduce the use of antimicrobials. But having said that, efforts are on. I mean, the OIE along with the tripartite, we have so many activities being undertaken at the moment at the country level. So even the countries themselves, they have actually developed their action plans. They are creating awareness every now and then. They have projects, activities very specific to create awareness at the farm level. They have activities to monitor the usage of antimicrobials at the farm level. They also have activities to strengthen farming, to strengthen better ways of farming in terms of improved biosecurity, sanitation, hygiene, vaccination program, good practices. So there are many activities being done to support the farmers. But I would say that it's a long process. I mean, we cannot expect the results overnight. So we need to really keep on this momentum, and we need to really spread the message of awareness about AMR and how we need the support of all the stakeholders, from the regulators, from the high level policymakers to the ground level, to the producers level. Yeah, that's very important.
Thank you very much. We have a few more questions, but for the interest of time, I will stop now. I hope this webinar gave you a chance to think about AMR as everyone's issue, not health sector issue alone. And we can agree that everyone has a role to play to tackle AMR. We will be discussing how we can contribute to the fight against AMR by changing our behavior as a consumer and producer at the ENVforum 2020 Stream 1 Health Agenda Post-COVID-19, example of AMR and Mindful Eaters on 9th of November. So thank you very much for everyone attending. Thank you very much for speakers. and see you soon.